If you don't mind seeing a little bit of surgery, and nothing too bloody, I don't think. I don't recall any blood. But yeah, if that doesn't bother you too much, then let's watch it. All right.
Become more like butter. It started off like feel that she is.
I love that the doctor describes her as being made of butter.
Incredibly fibrotic. I gotta say, one of the most fibrous patients I've done. I can feel that tissue release more and more, and become more like butter. It started off like stone, essentially, like rock hard, and now it's just softer and softer and healthier and healthier.
Okay, so we are here. No one is at the front desk because we are too early, but it's okay. I'd rather be early than late.
Oh, and one question here. I know some people here. You have some people here have some familiarity. Some of the people here, rather, have some experience with addiction and things like that. And I just thought it was really interesting. Well, really interesting. I just thought it was worth pointing out that Anna looks to be pretty zooted up on pills or something after the surgery, which is perfectly normal. But if she's going to be getting surgeries every month, that's going to be tough not to get all messed up on all those pills.
So I don't like waiting, though, because it lets my anxiety fester, which isn't great. But I am in the sickest outfit one could ever get surgery in. Let me show you. I mean,
that is, I totally can relate to that. That's why a lot of times I like to give everything at least 6 months. At least 6 months when I hear some news like that. And if 6 months later people are still saying it, then I'll maybe give it a whirl.
It is giving summer body ready. Surgery edition.
Good question, Fiona's mom. Very good question. From my understanding, well, actually, I'm pretty confident to say this. Liposuction removes fat, but your body still has the ability to gain weight. And if your body can gain weight, it's going to gain it someplace. So it may not be as unsightly, and it may not be as lumpy, and it may not be as fibrotic as the doctor described it. I'm not an expert on the precise nature of Anna's lipedema, but I do know that what caused her to develop lipedema has not disappeared. Whatever caused her to develop it still exists. And if she overeats and gains body fat, it can absolutely turn into more lipedema. So yes, she can gain it back.
Support.
Hopefully that answers the question.
Even when I'm going to be in full compression.
Yes, it will.
So stupid, but I love it.
Thank you, Skinny Queen. I know a lot of people here, they can relate to that, whether it's alcohol or drugs or overeating. People tend to have more than one. They tend to have addictive personalities across multiple things, like you said there.
So the anesthesiologist called me last night, and they're like, "We need to prepare you for, what's going to happen tomorrow." So they don't put you completely asleep. You're like, I guess cognizant, but like you can tell that they're moving around down there, and you can feel things, but you don't necessarily know what you're feeling. And apparently they talk to you throughout it. So, but yet at the
so this is one more interesting point. We're going to fast forward through some of the later material, some of the actual surgery video footage. But now she's talking about the surgery itself and how it feels when they perform it.
At the same time, you're not there mentally. So I'm very confused what this is going to feel like. The idea of something like in my skin and being able to feel it creeps me out to no end. But I'm sure it'll be fine. I just think it's so dumb. I was like, I want to go home in the dumbest thing ever. Here's the crazy thing. They put saline through it, and you can taste the salt in your mouth. It's wild.
That's the impression I get, Fiona's mom, that I've seen people who've had liposuction surgery, and it's been very successful. And it was invariably after some weight loss because the body fat shrinks down. And I understand that Glitter and Lasers, some parts of her body are not going to shrink down that much, but it seems like her doctor's goal is to remove all of her body fat. Like he's pointed out, he's drawn circles over essentially her entire body, saying that he wants to remove all of it, which just doesn't seem like a reasonable plan. It's like she's trying to use it for weight loss. She's trying to use liposuction for weight loss. It feels like.
It's wild. So cool. I didn't expect a culinary experience here.
What's going to happen is...
Oh, yeah. She talks about how she can taste the salt when they inject her with the salt.
Here's the crazy thing. They put saline through it, and you can taste the salt in your mouth. It's wild.
I bet she's going to ask them to inject her with sugar next, right?
Wild. I didn't expect a culinary experience here.
What's going to happen is Courtney's going to come in and talk to you over the anesthesia and some of the positioning.
For her sake, I hope she doesn't. Like, I really don't. I don't even, I'll be straight up. I don't even like glitter and lasers, but I don't want to see her fail. But I feel like she will. And I'm not saying anybody here who does, but I feel like it's inevitable. I feel like she hasn't solved any of her real food issues.
Everyone's going to come in and mark with his lovely markers. And then once you go into the OR, you get ready for your cold plunge, which is our prep. It's the cold prep that we put on your body.
So it's not like I'm not getting in an ice bath. No.
We call it a cold plunge because the prep is cold. A lot of patients say it's the worst part, but it's the HIPAA wash that you used last night. We just prep the areas again before surgery.
But just ice cold.
It's cold.
So they're just describing how she's going to wash with an antibacterial agent before she gets the surgery.
We keep it cold because
sanitary.
Bacteria. Yeah,
Yes.
exactly.
Dr. Amron's going to come in and draw my body, make me art. Well, actually, it's my markers for the incisions and stuff. So everybody's.
Thank you, Stackish. Yes, that's the impression I got. And you know something, Elizio, I think you're right. I think I have experienced that before. But yes, Stackish, the what do you call it? They gave her not a full anesthesia. They gave her what's called sedation, where she's semi-conscious, where she's not feeling pain. They've numbed her, but she's not fully out of it. And spoiler, the reason why, I shouldn't say the reason why, but one of the reasons why they chose not to give her full anesthesia is because she's too heavy. In Texas, she was over the BMI for any of the doctors in Texas to operate on her. So none of the doctors in Texas were willing to operate, but she found a doctor in California who was willing to operate on her at her current size. So I thought that was interesting too.
Get ready to fill in. And I'm walking because I was sitting for so long that my knees are just bugging me now. So I'm anxious. So I'm pacing. That's what I'm doing. I'm pacing. This close to crying. This close to crying.
She's this close to crying. No, Anna, you're always this close to crying.
Is this okay?
Wow, that is bright. Yeah. Okay, why don't you have me face me straight on, put your arm touch to touch.
Good night, Nancy.
How are your knees?
I'm sorry to hear that, Fiona's mom.
They've evaluated,
Hopefully that'll get better.
No, I don't think muscle wise. I think they're okay.
but I mean, the joint itself's okay.
I have not had them evaluated.
Wow, did you hear that? The doctor asked her, so how are your knees? And she said, I've not even had them evaluated. So this woman did all of that high impact exercise for God knows over a year, and she never even spoke to a doctor once. Says a lot.
Okay, well,
He ran out of marker. He
we
needed 4
talked
different
yesterday
markers.
about reasons why lipedema is so different than just regular liposuction surgery. It's a disease, fibrosis, complicated areas, all these things you have to understand, risk of clot formation. But one thing I mentioned was understanding how the disease itself presents, where it really is, where it kind of isn't, its primary areas, its secondary areas, and understanding it, and then forming your plan, how you're doing things circumferentially, semi-circumferentially in her case, is a little more advanced with stage 4 lipolipedema. The grouping of things, or doing things
He's
concomitantly
touching her. Like I don't know. It's just a little bit weird.
with surgical tightening procedures by a plastic surgeon, but it's really important to understand. And then after you understand, you have to design things. You have to engineer the process. Okay, a lot of it's not just artistry. It's understanding first. It's engineering design second. Ultimately, it's your performance. It's your physical performance of that all that design and artistry and all that stuff. We're doing our whole outer leg area today. Strategically, I want to
Okay.
proximally first before we start working in distal areas.
I thought you meant you couldn't taste any food either. Okay, well that's good then.
There's a very important area to do first, even in our buttock areas, understanding where the lipedema is
Probably.
and where it really isn't, and not just making a mess out of the buttock for no reason. From even a cosmetic standpoint, you want to decongest this whole area up into the lower back area, this area called the pelvic girdle, follow it around, and where this cosmetic unit, I call it, ends at the knee area is going to be done today bilaterally with it.
I love how he's managed to describe her entire body without once using the word fat. That is hard to do. This guy is an incredibly rich vocabulary to be able to do
again,
this.
where the access points are. If you're off, like I've said, half an inch or an inch, you're never going to get around curved areas safely and properly. There you go.
Yeah. I'll be honest. I'm anxious, but I think it would be I'd be delusional if I wasn't, right?
Yeah, like I've said before, only the weird ones are not anxious. So, I mean, I love doing things. I kind of hate things done to myself. I'm the same way with it. But we got it down. Every part of it we do it over and over again. The whole team. That's why I don't work with different people. It's all the same.
I trust you.
Do a little bit.
Just give me the happy drugs and we're good.
Yeah, get the happy drugs and all that stuff. But you'll do great.
I'm excited.
I'm just going to move you through the process, okay?
Okay.
So when we do the thighs,
Just give me the happy drugs, will be good. I think she's joking, but it's just like I said, she's going to be taking a lot of drugs. She's going to be on a lot of drugs from all these surgeries, and I just feel like she's not respecting the possibility of respecting the potential of what that could do.
positioning is really important for Dr. Amron.
Okay.
When you're on your side, he's going to want you on your hip and your shoulder,
Okay.
and he's not going to want you in the fetal position. So a lot of people, they get excited and they want to curl up on their side.
Yes, that is what I would like to
That makes sense.
do.
Yeah. So he's going to want you nice and straight. So hips straight. He's going to want your arms up by knee and almost your hips pushed a little bit more forward than the rest of your body. When you're under anesthesia on a really narrow bed, it's hard to figure out where you're at. So a lot of people will stick their butt backwards. If he tells you to do a pelvic thrust forward, just means pull your hips toward whatever way you're
Like
facing.
that.
Like that.
I got to say that this video is a little bit boring, but I just wanted to show it. I mean, we're going to be fast forwarding through some more of it in a minute, but I just wanted to show it just as part of the whole. If I'm going to cover Anna's surgery, I want to cover all of it.
Okay, guys, it's time to go into my first surgery. We'll see you guys later.
Anna, how you doing?
Okay, I'm going to skip through this part here because I don't want to see the actual surgery itself. I already forced myself to watch some of this. So we're going to skip through some of this just so nobody has to see it unless they want to.
Softer and softer and healthier.
Okay, so they're wrapping me now to go home. This is the easing I mentioned in other parts of this video. Well, actually, in the last video. But basically, it's all of that stuff releasing from my body, which is good. It's gross, but it's good and it's healthy. So it's vile how
Thank you, Nirvana.
I feel after surgery.
Good to have you in, Nirvana. We're going to be winding it down soon, but we're glad to have you in. Hopefully you can make yourself at home till, for the little bit that's left.
I'm alert. I'm a little bit shaky. I can't feel anything they're doing.
I think it's interesting.
Which is weird. And getting the compression garment on.
I'm glad you think it's interesting, Fiona's mom. I find it interesting personally, but I never know what other people are going to think.
Was less work than I thought it was going to be. But then again, they put it on me. So maybe that's why. I just realized, like, it wasn't that hard to put it on when I realized I didn't put it on. So maybe the pain and like the drugs are still in me a little bit. So I just can't.
Anyway, I want to say on one hand, it seems like she's not really that intoxicated, which I guess is a good thing. I guess they're not, pumping her too full of drugs. She seems pretty alert, considering how much medication they've likely given her. I'm surprised to see how alert she is, which I guess is a good thing.
Came out of my first surgery, and I did my outside thighs and my hip shelf, I think it's what it's called.
It is very much for real, Nirvana. I fast forwarded through the surgery video. If you want to see some of it, it's kind of disgusting. They actually jabber with the metal thing. I forgot what it's called.
They took out, I believe, 12-ish liters of lipedemic fat, and
It's got 12 liters of fat. That is a lot of fat to take out. And if she's going to keep getting all that fat taken out, I mean, I hope it works out for her, but it just sounds like a very serious procedure. And it has to, the thing is, she hasn't solved any of her food issues though. And where's the weight's going to have to come back, isn't it?
what Dr. Amber was telling me, which was like wild, that I didn't even realize. Again, guys, I'm a little still drugged up right now. So if anything's a little slow or weird, that's why. He said that it was like way more fibrotic than he initially had thought, which means it's, again, really good that I took care of this now versus like waiting on it, because it could have caused a lot more problems.
I love how she says that. It's good I took care of this now rather than waiting on it. What do you mean waiting on it? You haven't taken your health or your weight or any of your body fat seriously for years. You've only just started working on it. And so you're going to act like happy that, oh, I'm glad I took care of this so quickly. You've allowed this to progress to in your own words, what, stage 4 or phase 4? What do they call it? She's allowed her lipedema to progress to the farthest possible level before seriously addressing it. And now she wants to act like she's done something good by addressing it so quickly.
I want to say shout out to Courtney, who was the anesthesiologist. She stayed with me the whole time. So anytime
Wow,
I
that's yuck.
any discomfort, she was like on it. And I think because I had so much fibrotic tissue, that
That's a
happened a
lot.
couple times, but I never felt any true pain. It was just like a little like, oh,
like I said, I may not care much for Anna, but I don't wish ill on her. So I hope she does better. again, agreed, Nirvana. I don't see any sign of Glitter and Lasers even trying to address her health. She just wants to get surgery. She just wants to get surgery and then be done with it.
This might progress into that. And then she was like, all right. Honestly, I am, how many hours? What time is it now? Like 10?
And by the way, this is her hospital room. See this reflection over here in the upper left? This looks like, is this a reflection of glass servingware on her plate? Like, this looks like glass or silver, doesn't it? It looks like she has a silver serving dish or like a glass. I can't tell what this is, but this looks like some kind of, like a reflection of some kind of silver platter.
10:30 at night. So I had my surgery
Doesn't it? It looks like there's a silver food dish or something in there. I can't really tell.
finished around 2. I feel fine. I'm actually like weirdly confused how okay I feel. I was dancing. I walked a mile.
She was dancing and she walked a mile. She must be on a lot of medication because she's always talking about how much pain she's in. But for her to do all of that after getting surgery, I mean, it could just be possible she's very tough.
It's like better. It's better than I get into surgery. So I don't think this is the norm, especially for someone in a stage 4. But I'm not mad at it. I'm not mad at it at all. I'm very grateful that this is the case. I have leaked a lot of fluids, but honestly, every time they've come out, I've just felt better and better. So I think it's just part of the process of feeling better. It's not the sexiest thing, but man, I feel amazing.
All right. Well, that is that, folks. All right. I hope you've had fun tonight. I hope you've enjoyed the show. Does anybody have any final thoughts or anything they'd like to share with us? Let me, so let's put on the bumper. Let me put on my little bit of music, and I'm going to start seeing us off in just a moment. All right. Dinner with the Doctor show is nearly finished. Thank you, everybody, for coming on tonight. You've been a great audience. It's always a pleasure to have you.